vitamin deficiencies, direct toxicity of ethanol, and toxicity of its metabolite, acetaldehyde. Ethanol is toxic to all cells because it's an organic solvent, soluble in both lipids and water. Because of its solvent nature, ethanol can penetrate into the lipid membrane of the neuron. The membrane can be disrupted, and its electrochemical activity inhibited, or it may sustain serious damage. The metabolite of ethanol, acetaldehyde, is also toxic to neurons. Acetaldehyde is a very reactive compound. In particular, it will react with amino groups to form compounds known as Schiff bases. Acetaldehyde can form Schiff bases with many biochemical compounds, including proteins and neurotransmitters such as catecholamines. This may explain a major toxic effect that acetaldehyde has on cells, including neurons. An acetaldehyde or ethanol-induced disturbance in the chemistry or functioning of neurotransmitters may be a contributing factor in the development of neuropathy. Several of the neuropathies observed among alcoholics have been correlated with vitamin deficiencies, particularly thiamine and niacin deficiencies. Although it is not clear how thiamine or niacin deficiencies affect nerve tissues, there are some possible explanations. Thiamine pyrophosphate is a necessary coenzyme in the conversion of pyruvate, the end product of glycolysis, to acetyl coenzyme A, which can then enter the Krebs cycle to be oxidized. A thiamine deficiency would result in the incomplete oxidation of glucose. Thiamine pyrophosphate is also a necessary coenzyme in the phosphogluconate pathway. One of the end products of this pathway is a precursor for the synthesis of the lipids, which are components of cell membranes. It is believed that the phosphogluconate pathway is important in the synthesis of the membranes of the nerve processes and of the myelin membranes produced by the Schwann cell. Thiamine avitaminosis would therefore inhibit the growth of nerve axons and their myelin sheaths. The vitamin niacin is converted to its active form nicotinamide, which is a component of the universal reducing agents nicotinamide adenine dinucleotide, or NAD, and nicotinamide adenine dinucleotide phosphate, or NADP. These coenzymes are used as an energy source in many biochemical pathways. A niacin deficiency could have serious effects on many cells, including neurons. The earliest clinical sign of both niacin and thiamine deficiencies is neurasthenia, marked by fatigue, irritability, depression, and memory loss. The advancing course of the deficiency disease will proceed to a bilateral, symmetrical peripheral neuropathy. Peripheral neuropathy is the most common nerve disorder among alcoholics. The cause is either vitamin deficiency or the direct toxicity of ethanol and acetaldehyde, or a combination of both. Sensory and motor impairment begins at the most distal segments of the limbs, particularly the feet. The feet and hands are affected more severely than the upper portions of the limbs. Symptoms include burning and tingling, which progress to numbness, weakness, and wasting. In addition to peripheral neuropathy, some alcoholics may show some cerebral cortical atrophy, which may exist in mild form with symptoms of fatigue, depression, listlessness, irritability, and anxiety. The early stages may be reversible if abstinence ensues, but in some cases the pathology may progress to a dementia characterized by confusion, recent memory loss, lack of concentration, impairment of reasoning, and loss of motor control. An uncommon form of cerebral atrophy, sometimes found in alcoholics, is Wernicke's encephalopathy, a result of thiamine deficiency. Symptoms are paralysis of ocular muscles, somnolence, and ataxia. This condition can be reversed by abstinence and thiamine therapy. Wernicke's encephalopathy can progress to Korsakoff's psychosis, characterized by short-term memory loss and confabulation. This condition cannot be completely reversed. Other less common neurologic diseases among alcoholics include cerebellar degeneration, demyelination of the pons, and demyelination of the corpus callosum. All of these have been correlated with malnutrition. Head trauma and generally poor health probably account for the fact that there is an increased incidence of subdural hematoma, brain abscess, and meningitis among alcoholics.